A matter of health or justice? As BC's drug decriminalization pilot comes to an end, public opinion on its effectiveness is split.
We don't think that it met its objectives.
I really reject the premise that decriminalization was a failure.
The province decided against renewing the 3-year pilot project, citing a lack of results. But those familiar with the impact caused by the policy shift said it made a real difference.
It decriminalizes us.
Garth Mullins was involved in the negotiations that led up to decriminalization. He says the pilot was never given a real chance after it was drastically curtailed 18 months in amid intense scapegoating.
If street disorder and public drug use is because of decriminalization, then why are those issues happening in Toronto and Edmonton and lots of other cities where there has never been decriminalization?
The pilot allowed adults to legally possess up to 2.5 grams of certain hard drugs, with a stated goal of reducing stigma and barriers to seeking care, something that SFU policy expert Dr. Cor DeBeck says was achieved.
What we've actually found is that decriminalization, there's lots of data to show that it was doing what it was set out to do. I see no good grounds for ending the pilot from a public health and community perspective.
Overdoses and deaths also trended down, but it's not clear yet whether that's attributable to decriminalization. Regardless, critics say those public health gains came at a cost to our social fabric.
It resulted in a greater public use of drugs, which also led to other unintended circumstances like deterioration of some neighborhoods, some business areas, and people's sense of safety was also impacted pretty dramatically.
In the downtown east side, residents say they worry about an uptick in interactions with the police.
But there's a lot of animosity between the users and the police.
Jessica Keller says that public drug use is an issue, but the reasons behind it are systemic. There aren't enough places where you're allowed to do it, and there aren't enough supports for people who are trying to stop.
We're not dangerous people down here. I don't think anybody down here aspired to come down here. I think a lot of people want help and they can't receive it.
Felt like they were being invited to rejoin society.
Advocates say decriminalization prevented users from getting caught up in the legal system unnecessarily, allowing them to hold on to jobs, permits, and ultimately their lives.
Governments seem completely comfortable to just stand beside a grave and watch us fall into it.
As we approach 10 years since BC labeled the toxic drug crisis a public health emergency, the emergency is still clear. But those affected by it suggest the emphasis on public health is coming out of focus. In Vancouver, Jack Rabb, City News.